In 1869, Newark German Hospital was established in Newark, New Jersey. This hospital was founded on these words of dedication. This institute is organized on broad principles, admitting cheerfully the afflicted of every class, nationality, and creed. Some decades later, in 1952, Newark Memorial Lutheran Hospital, formerly known as Newark German Hospital, was renamed Clara Maass Memorial Hospital, where Clara Louise Maass was named chief nurse some years earlier.
Clara Louise Maass is so very important, not only for the history that comes along with her, but also for this facility in particular. Clara Maass was born in East Orange, not too far away from our location. Clara Louise Maass was a nurse, where she was trained right here at this facility in School of Nursing. Her nursing professor actually was trained by Florence Nightingale herself. She really gave her life back in the Spanish-American War, where she worked with Walter Reed, but down in Cuba. And she allowed herself to be part of a human experiment with Walter Reed, where he was trying to find a vaccine for yellow fever. On the third bite that Clara sustained from the mosquito, she was not able to survive this incident. She was so selfless in giving up her own life so that it could benefit other people from all around the world.
That is unique when we learned about how she gave her life for the practice of health care and what she did. A Clara graduate never misses the opportunity to tell others about what Clara did.
The area where the hospital is built was Nanny Goat Hill. Growing up, we used to play up here. There were mulberry trees and everything. Dirt road, Newark Avenue was a dirt road. I was here with my family when they put the first shovel into the ground to build Clara Maass. So to see a new hospital coming where people could come and, you know, be safe and be taken care of was a wonderful experience.
I've been involved with, or in either directly or indirectly, with the medical center for over 50 years. I grew up in the town over Nutley. In fact, my father was on the board of trustees here in the 70s.
I grew up in Belleville, and I knew of the hospital because I guess it was built in 1957 or thereabouts, and I was actually a patient.
Once we moved in to be a part of the Barnabas system, things started to improve dramatically. Of course, bringing in Tom Biga was the biggest step to move us along in the improvement process. After Tom, we had the good fortune of having Mary Ellen CLYNE take over, so that there never was any backward movement by the hospital, but continued progress.
Our administrator, Mary Ellen CLYNE, is an individual that is such a wonderful asset to this facility. She's the face of the facility. She's always involved with the community, and they care about the community.
One such community program is the Center of Excellence for Latino Health.
This work is so important because we try to address the need for the community in a culturally sensitive way, addressing language, making sure that our signs here in the hospital are in English and in Spanish. We establish outreach where people are. Opposed to having people come into the hospital, we meet them where they are, in their churches, in their civic groups, in order to establish these different programs to allow them to seek preventative health care.
So we've developed some good relationships with the corporations and individuals through our special events, the golf outing and the Tasteful Experience. These relationships result in investments that help the medical center move forward.
We are moving continually in the correct direction, and as of late we've put in some capital expenditures that have made a tremendous difference. The intensive care unit has 32 rooms. Also, we have 6 new operating rooms.
The operating rooms have increased in modernization as well as the number of operating rooms.
In addition to the capital expenditure on the ICU and the operating rooms, we have dramatically improved the emergency room. And These things are making a tremendous difference in the quality of care that we are able to give to our patients.
There's obviously several hospitals in our area that have in the last few years closed. In fact, in the last few years we've actually grown, and I think that's a testament to administration and our medical staff. And I think looking towards the future, we're going to be a pillar of this community for the next 150 years.
My father always felt that this hospital had a special relationship with the community from what he saw being a patient at different aspects of his life and also being on the board of trustees. He felt that this was a facility that really cared about the community.
As I look back over 150 years ago, I am so impressed that the founders of Clara Maass Medical Center wanted to ensure that we could take care of everybody who had a need for health care. And 150 years later, we are still committed to our founding principles, and I am so proud of it.
My family has always had their health care provided here by the physicians and the nurses. My own health care has been provided here. I wouldn't go anywhere else.
Clara Maass Medical Center and all of RWJBarnabas Health are committed to being healthy together. To everyone at Clara Maass Medical Center, may you have a wonderful and happy 150th anniversary.